I am Zara Alvarez. I am 38 years old, the Research and Advocacy Officer of Negros Island Health Integrated Program for Community Development, or NIHIP-CD. We are conducting research in the community. We are documenting cases of health issues and environment issues together with the Defend Patrimony Negros and Southern Negros. I was imprisoned for 1 year, 8 months, and 22 days because of my advocacy work.
You heard the voice of Sara Alvarez, a social leader, human rights defender, a health activist, and a former education director of the Human Rights Alliance, Karapatan. Well known for her steadfast commitment to supporting the struggles of farmers, agriculture workers, and other marginalized sectors in her home province of Negros, the Philippines. Sara was red-tagged and falsely slandered as a terrorist, making her a target of death threats. However, despite this, Sara still continued to promote the right to health and defend human rights. In August 2020, Sara was gunned down by unknown assassins. In this episode of Charter4Health, we take a look into the current situation of human and health rights defenders and health workers in the Philippines, as well as the economic pressure on people to access health in the Asian archipelago. Welcome to Charter4Health, a PHM podcast series on the right to health. Hear the voices and insights of health rights defenders at the forefront of the struggle for health for all from all around the world. I am your host, Miguel Garcia, and this is Charter4Health, a podcast series from PHM Global. Follow and share from wherever you are on iVoox or go to our website, phmovement.org. We are the People's Health Movement. Join us in the struggle for health for all. Our guest today is a public health physician and health rights defender, Dr. Delen De la Paz. She is the National Coordinator of PHM in the Philippines. She is also the Chairperson of Health Alliance for Democracy, HEAD, an NGO with members from among health workers and health students working for the people's right to health access for free, comprehensive and quality healthcare services within the strengthened public health system in the context of the struggle for nationalism and democracy. Hello, Delen. Welcome to the program.
Hello. Thank you, Miguel, for inviting me to share what's happening in the Philippines with all our colleagues around the world. Thank you.
How would you describe the situation for health rights at the moment in the Philippines?
We are currently in the forefront of a campaign to really advocate for the people's right to health because it has not been achieved here in the Philippines. In fact, we're having problems now because the budgets for health services being coursed through the Health Insurance Corporation is being threatened to be removed because the government wants to get back whatever savings it has to be given to the National Treasury for unprogrammed projects. And we are quite anxious about this because it can be used for corruption. It can be used for other projects when it has really been intended for health services. So we have been advocating for budgets to be directly to be given to the health centers, to the health institutions, the public health institutions, so that people who are sick can readily access them whenever they have health problems. But the situation now is that people who are sick sometimes do not want to go to the hospitals or to the health centers anymore because there's nothing there for them, except maybe they're given a prescription or they're attended to, but there are no free medicines, no free laboratories, and sometimes consultations are not even free. So health service delivery is very, very bad right now for the public health service in the Philippines.
How the situation has changed since the new government came into power?
Well, not much really has changed. In fact, it has worsened. Through the years, government has looked at health only as a token support to people, but it's not really addressing the comprehensive health needs of the people. So right now, it's really making people pay for a lot of their services. So there's a lot of out-of-pocket expense. There is inaccessibility in terms of distance, physical in the far-flung communities. They're mostly in the city centers or urban centers. And then health professionals are really going out of the Philippines because of lack of good salaries. The health workers are overworked and underpaid. There's a lot of understaffing of health workers in public hospitals, so much so that you will see a long queue of patients waiting to be attended to at the emergency rooms, and the wards are full. Many people are really crowding into the public health system because the private health services are very expensive. But because the public health facilities are themselves overworked, so really a lot of people die without even seeing any medical attendance. It's very sad.
The Philippines has a very strong community-based health system. What can you tell us about it? How has it grown over the years? What is the impact of this system on giving people access to health rights?
The community-based health programs in the Philippines started in 1973 with the initiation of the Rural Missionaries of the Philippines after martial law was declared in 1972 by then President Ferdinand E. Marcos Sr., the dictator father of the current president. Health services were very inaccessible. They were not readily available. So, and also because a lot of health professionals left the country when martial law was declared. And so the rural missionaries, through some doctors and nurses and other health professionals, also with the support of the Catholic Church, started training community-based health programs in the countrysides, encouraging them to work as a team and also to giving them lectures on traditional medicine, common basic health problems, organizing skills, teaching skills. So this went on throughout the years of martial law, and up to the present, the community-based health programs have been very helpful in teaching the people what to do, how to attend to their medical needs, how to harness their own local resources, and how to also teach themselves and organize themselves as community health workers. But lately, the problem is that because people began to be organized and were able to advocate for their rights, they realized that they were not receiving what they should be receiving. The community-based health programs have been looked upon by government as a negative initiative in the sense that they look at it as counter-government. And so right now, the community-based health programs are being the targets of what we call red tagging, where they are being vilified and their actions are always equated with terrorism. So we have to advocate that CBHPs and community-based health workers are not terrorists. They are activists who are teaching the people their basic rights, including the right to health. And so they should not be vilified. But we've had sad cases of nurses from our health programs having been killed on the false allegation that they are supporters of the rebels or supporters of the communists. We also have doctors who have been charged with false accusations, and so they are not able to move freely now on the threat of being arrested. So the CBHPs are currently under threat because of this red tagging and vilification by the government on what we are doing. But we have been able to organize thousands of health workers all over the country. And maybe because of this successful organization of health workers, making them realize what their rights are, that's why the government is threatened.
You're listening to Charter4Health, a PHM podcast. Stay with us.
We
are the People's Health Movement.
PHM brings together health rights activists and organizations from around the world.
For over 2 decades, PHM health defenders have been at the forefront of the struggle for health for all.
We maintain an independent voice without fear or favor.
But now we need you to stand with us.
We need your support to continue our critical and independent intervention on all health matters.
To contribute to our cause, go to our website, phmovement.org, and find out how.
Contribute
and say
proudly
that you support
health
for all.
Health for all.
Health for all.
Health for all.
Health for all.
Follow the discussions on health issues at the World Health Organization on the WHO Tracker website. Through the WHO Tracker, PHM closely follows the work of the World Health Organization and prepares commentaries on agenda items at the WHO governing body meetings. These include background and critical health perspective analysis with recommendations for policymakers and civil society. Visit the WHO Tracker on the People's Health Movement website at phmovement.org. Join us in the struggle for health for all.
Yeah, I was really going to ask you about this because according to civil society and human rights organizations, the Philippines is next to Honduras, Brazil, Mexico, and Colombia as one of the most dangerous places for social leaders. Even in PHM, we have reported cases of health workers under attack, like Dr. Nati Castro, who was incarcerated, and the assassination of Dr. Mary Sansalan and her husband, and the crime against Sara Alvarez.
Yes.
What else can you tell us about this situation? Why is this happening, and has the situation improved since the change of government, or what's the situation now for human rights and health defenders in the Philippines?
It has not really improved, and in fact, it has worsened because the military structure that the present government of Ferdinand Marcos Jr. is the same military structure that the former president has, Duterte. And they really want to wipe out the organized groups from the communities with a false accusation that we are terrorists. During the Duterte time, they passed the anti-terror law, saying that those who are working or organizing people to go against government are considered terrorists and they should be arrested. In fact, some even said that they should be killed. So we have been fighting against this anti-terror law, and we are saying that we are activists, we are not terrorists. So with the new government of Bongbong Marcos, is actually not new anymore because he has been here for 3 years. The same situation is there because he continues to question organized activities. He continues to charge our leaders, especially in the urban poor communities, the workers' communities, of being terrorists. So it's the same as the Duterte administration. And there's a lot of killings still and forced disappearances. In the provinces, they're dropping bombs in communities. This is not being published in the newspapers because they're having they clamp down on publishing these issues. But people in the countryside are terrified because once they see that there is organized activity going on in this community, they will really terrorize you, they will threaten you. And in some instances, they have really dropped bombs in the communities. And we've had community leaders killed in the process. So we have a case filed in the courts against some of the newscasters, radio newscasters, who have continued to vilify us. So we have asked the Supreme Court to stop them from airing all these false accusations against us. And the Supreme Court has said that red tagging, which is what it is called here, is something that is threatening to people's health, and it should be stopped. But this continue because they have the support of the national government.
You have been very vocal about the working conditions of health workers in the Philippines in terms of wages, brain drain, workloads, privatization. How would you describe the situation for the health workers in the Philippines right now? What's the pressure that they have to go under?
The current problems now is understaffing. Many of the nurses and other health workers who can no longer stand the pressure, the overwork, underpaid situation, have applied for jobs overseas. And many of them have been taken to work abroad. And so now the hospitals have lack of personnel. We have been advocating for the hospital administration to fill in this positions that have been vacated, but they don't because they don't want to spend additional money. So they're just taking in they're just having all these remaining workers. So sometimes they go on duty for 12 hours and overtime pay is also very slow in coming. And the health emergency allowance that was promised to them during the COVID pandemic that they will be receiving because they were really working overtime during the pandemic, not going home because they were not allowed to move around because of the lockdown. They were promised a health emergency allowance. Up to now, many of these health workers have not received their health emergency allowance, which was supposed to have been given to them since 2020. And again, the government is saying there's no money. But why should there be no money? They have a lot of money they're using for infrastructure. They're building new clinics. They're building new health centers. What are they? White elephants, because they have the health centers, but they don't have the personnel. Also, the support services for these health workers are not readily available. So some of them get sick, but they don't get enough support from the hospitals where they are working in. And the salary has really been very low. The minimum wage right now is about 600 pesos. That's only about $12. And no, 600, it's 60 pesos to $1. So yeah, about $10. So that's, how can you live on that? So we're really demanding for a living wage increase. It has to be a living wage increase because you have to support the families of these health workers. You cannot just give salaries for themselves, but to consider also their families. And the government has not responded yet to our advocacy to provide living wages for this family living wage for these health workers.
Do you have any message for the health workers? Anything else you want to add?
Well, the health workers have been striving so hard to really provide for our health needs. So we salute them. We appreciate all the work that they're doing. And so we expect government to reciprocate and give them the just wages that they need, the good working conditions that they should be working in, and to respect the advocacies of these health workers for a just family living wage that will provide for their services, for their needs. So they should not be encouraged to go abroad. There was an instance when the government told the health workers, oh, you're not satisfied with your salaries here, then why don't you just go abroad? You will be paid better abroad. So what kind of attitude is that? Instead of encouraging them to stay here and work here and provide for the needed health services, they're the ones pushing our health workers away. That's why we continue to be the exporter of nurses to the world, the number one next to India, rather. So it's really something that the government has to address right now because we might soon be having hospitals without health workers.
Well, Delen, thank you so much for joining us. It was really nice talking to you.
Thank you, Miguel. And all the best to you and your work. Thank you.
We are the People's Health Movement, bringing together health rights activists from around the world. Join us in the struggle for health for all. This episode of Charter4Health was produced by David Verstock. Technical support, archival audio, and editing by Luisa Fernanda Viatela. Special thanks to Viva Salud Carapatan and One News Channel in the Philippines. My name is Miguel Garcia, and this is Charter4Health, a PHM podcast. You can find much more about PHM and its call to action by logging into our website, phmovement.org. This is a People's Health Movement production.
We
Are the
People's
Health Movement.
PHM brings together health rights activists and organizations from around the world.
For over 2 decades, PHM health defenders have been at the forefront of the struggle for health for all.
We maintain an independent voice without fear or favor.
But now we need you to stand with us.
We need your support to continue our critical and independent intervention on all health matters.
To contribute to our cause, go to our website, phmovement.org, and find out how.
Contribute
And say
Proudly,
That you support
Health
For all.
Health for all.
Health for all.
Health for all.
Health for all.
Follow the discussions on health issues at the World Health Organization on the WHO Tracker website. Through the WHO Tracker, PHM closely follows the work of the World Health Organization and prepares commentaries on agenda items at the WHO governing body meetings. These include background and critical health perspective analysis with recommendations for policymakers and civil society. Visit the WHO Tracker on the People's Health Movement website at phmovement.org. Join us in the struggle for health for all.
Hey everyone, I'm Chiara Bodini, co-editor of the Global Health Watch 6, flagship publication of the People's Health Movement. I am also a producer of the GHW podcast. Listen to the first season of our podcast in English, Spanish, French, and Arabic on iVox. You can also go to our website phmovement.org/GHW-podcast.
Hi, Sean. The Makabayan bloc here in the lower house is demanding for accountability over the ambush of a doctor and her husband in Negros Oriental. During their weekly online press briefing, the progressive lawmakers insisted that the deaths of Dr. Mary and Edwin Sancelan prove how dangerous and baseless red tagging is. The couple had been included in the red tag list of a vigilante group. Gabriela Representative Arlene Broses said the incident was not the first of its kind in the region. She also questioned the lack of action from the police to probe the killings, despite the state forces' rampant linking of some individuals, including them, to communists. House Deputy Minority Leader Carlos Zarate encouraged the public to continue speaking up.